You've been bleeding in your pregnancy and it's caused you so much concerns, understandably of course. This video is for you. In this video, I'm hoping to give you some guidance with regards to the different types of vaginal bleeding that you can experience during pregnancy. I'm also going to talk you through what the blood looks like, what it means, and whether or not the type of bleeding that you are experiencing is normal. Hi, I'm Dr. Kady. I'm a board-certified family doctor. I have a special interest in fertility medicine, any pregnancy-related topics, as well as women health in general. And those are mainly what I talk about here on this channel called Hey Doc. So if that type of thing tickles your fancy, please remember to subscribe. Vaginal bleeding in pregnancy can be, of course, very concerning because most women associate any form of vaginal bleeding during pregnancy with a miscarriage or a threatened miscarriage, shall I say. But bleeding in pregnancy, would you believe, is rather common, and it is not always associated with a serious pathology. The cause of the bleeding is very often associated with the stage at which the pregnancy is at. So let's dive right into what these causes are. The first cause is implantation bleeding. This type of bleeding occurs very early on in your pregnancy, and as a result, women will often confuse it with a period. Implantation bleeding happens when a fertilized egg starts to implant and embed itself into the thickened endometrium, where it will remain, and eventually a placenta will form which will support the baby throughout those 9 months. Typically, implantation bleeding is seen 6 to 12 days after conception has happened. And if you look at the menstrual cycle, you will realize those couple of days after fertilization has happened is normally when the progesterone levels will be expected to drop, thereby triggering a period. But most women will describe the bleeding as rather light. In fact, many will use the word spotting. And instead of that expected period lasting 4, 5, 6, 7 days at a time and being of a normal period flow, not only will it be light, but it would tend to last around 3 days max. Is implantation bleeding normal? Absolutely yes. Does everyone get an implantation bleed? Not always, but for those for whom it happens, they can often use that as an early sign of pregnancy. In fact, it's used as an early sign of pregnancy in many women. Having said that, of course, if you don't get an implantation bleed, do not worry. It does not necessarily mean that you are not pregnant. On this channel, I have a whole video where I talk about just implantation bleeding. How can you tell an implantation bleed from a period? After you finish watching this one, that video is well worth a watch. The next type of bleeding that happens early on in a pregnancy can be due to a miscarriage. Now, there are various causes for miscarriages. And again, on that topic, I have done a video about the causes of recurrent miscarriages. Don't wait until you get multiple miscarriages before you watch that video. If you've experienced one miscarriage, that is traumatic enough. So I encourage you to go ahead and watch that video because I describe all of the different things that can lead to a miscarriage. So if you get to find out about those causes early, you can address them, preventing any further miscarriages from happening. Now, back to the causes of vaginal bleeding in pregnancy. For the sake of this video, we will use one of the most common causes of a miscarriage, which is just a spontaneous end of the pregnancy. Very often, we just do not know why the lady has miscarried. But of course, there are many, many other reasons for miscarriages, one of which includes chromosomal abnormalities. Again, I encourage you to watch that video. It will really be helpful, particularly if this traumatic event has happened to you. The majority of miscarriages tend to happen in the first trimester. The first trimester is literally the first 12 weeks of the pregnancy. The type of bleeding that you will experience when you are having a miscarriage will be dependent on the type of miscarriage that you are having. If you are having a threatened or a missed miscarriage, the bleeding is likely to be light, spotting, you might get some pinkish or even brown discharge. On the other hand, if you are having an incomplete miscarriage or a complete miscarriage, then the bleeding is going to be heavy. You're likely to pass quite a few clots. And these two types of miscarriages are associated with lower abdominal cramps. And if you're going to have a complete miscarriage, the cramp can be quite severe. And some women have described going to the toilet and passing tissue. Many have been bold enough to reach out into the toilet and to take that tissue, and they realize that it's the yolk sac. So under those circumstances, because they've passed all the tissue of conception, the bleeding is going to be a lot heavier. And I pray that that doesn't happen to you, but if it does, you need to get yourself to the hospital, because the doctors are going to need to stop the bleeding so that you don't get other complications from losing too much blood. Miscarriages sadly happen, and countless other women who are then able to go on to have successful pregnancies, some after a month or two of having the miscarriage. However, miscarriages become abnormal, or certainly something to look into if it becomes reoccurrent. Clinically speaking, a reoccurrent miscarriage is defined as having 3 or more miscarriages. But how many of you would agree that even after the first one, you are so on edge and you want to make sure that it's not happening again? So yes, miscarriages are common and they can happen as long as you're not getting more than 2. And I pray that even if you do have 2, that in between those 2 happening, you are having successful pregnancies and delivering healthy children. The next reason is because you are having an ectopic pregnancy. This is when the fertilized egg starts to implant itself outside of the main uterine cavity. Very often, 90% of cases, it implants itself inside of the fallopian tube. And because the fallopian tube is not designed to support a pregnancy for 9 months, in other words, it doesn't have the structural capacity to allow the baby to grow, the tube will rupture, causing you to have severe, sharp lower abdominal pain. And this will be associated with bleeding. Now, I would say if you have a combination of you are actively trying to get pregnant and then you get a sudden onset of severe lower abdominal pain followed by or associated with vaginal bleeding, I would actually argue that's good news, because some women will tend to downplay the lower abdominal pain that they're getting. They may think, oh, I'm trying to get pregnant, or I've tested positive on a pregnancy test, and so lower abdominal pain in pregnancy is expected. But most women start to panic when they start to experience vaginal bleeding when they know that they're pregnant. So that encourages them to go to the hospital to get checked out. Now, with an ectopic pregnancy, remember, if you are bleeding vaginally, it almost certainly means that you are also bleeding in your pelvic cavity and in the peritoneum area of your abdomen. And this will cause irritation of the peritoneum, which is the lining of the abdominal cavity. And this will also be associated with shoulder tip pain. Now, this doesn't always have to happen, but if it does happen, it means that you are bleeding quite a bit in your abdominal cavity. The bleeding that happens with an ectopic pregnancy is a type of light brownish spotting type of vaginal bleeding. But remember, it can also be quite heavy, particularly if you are bleeding a lot in your pelvic cavity because your fallopian tube has ruptured. By the time that happens and you're getting a lot of blood through your vagina and getting a lot of abdominal pelvic pain, you are going to start feeling dizzy. More than likely, you're going to feel that your heart is racing. And that happens because you're losing too much blood and you're not having enough blood perfusing your brain. And of course, goes without saying that if this is what you are experiencing, you must get yourself to the hospital immediately. Ectopic pregnancies are life-threatening. Now, how are you able to tell the difference between an ectopic pregnancy, a miscarriage, and an implantation bleed? Well, implantation bleeds hardly ever cause you pain. It's just a minor, mild type of period pain cramps that you will get with that one. And again, it is light. With a miscarriage, particularly if it's a complete miscarriage, you're going to get a lot of consistent period pain cramping. So it's going to continue until you have passed the product of conception. But if it's a threatened miscarriage, you might just feel a little bit of cramp, and that's it, and that will stop, and the bleeding will stop and start and stop. And remember, with a threatened miscarriage, the whole product of conception has not been expelled. It's still there, so the pain may not always be there. With an ectopic pregnancy, on the other hand, your key marker is that sudden onset of severe lower abdominal pain. And because ectopic pregnancies happen most of the time within the fallopian tubes, you are going to usually experience that sharp, sudden onset of pain on one side of your pelvis. Whereas with a miscarriage, remember I've said it's strong or light period pain type of cramps, but it's going to happen across your lower abdomen as opposed to one side being severe, sharp lower abdominal pain, the latter of which is an ectopic pregnancy. I hope that makes sense. Another marker that will help you determine whether or not this is an ectopic pregnancy is that ectopic pregnancies are usually identified between 4 to 12 weeks. Why? Because that's when the baby starts to grow and the fallopian tube is no longer able to sustain that life. Now, what you want is that your ectopic pregnancy is identified and diagnosed as quickly as possible. So you want it closer to the 4-week mark rather than the 12-week mark. Honestly, if it's closer to the 12-week, it will literally be a miracle for that woman to still be alive. Subchorionic hemorrhages or hematomas. This happens when there is a pool of blood that collects between the uterine wall and the chorionic membrane surrounding the embryo. It's more common in the first trimester. In fact, this is the main cause of vaginal bleeding, particularly in early pregnancy. So more often than not, it has nothing to do with an ectopic pregnancy or a miscarriage. It's just a subchorionic hemorrhage. And this is a confusing thing. The bleeding can be anything from light to being quite heavy, and at times passing even clots. And because of that, I can completely appreciate the apprehension that women have when they present with vaginal bleeding in pregnancy. Although subchorionic hemorrhages are very common and they are very non-sinister, most of the time it's not a problem at all. That woman will carry her baby full term without any problem. It's worrisome because it has very similar characteristics to a miscarriage. With subchorionic hemorrhages, you don't tend to get pain. And depending on how big this pool of blood is, the woman, like I said, she could just be having light spotting or she could be bleeding more heavily. And it is this condition that can cause some women to bleed throughout their pregnancy. But of course, these women should be having regular scans to make sure that their placenta is not sitting too low and to ensure that their cervix is also closed and that there are no other reasons for this vaginal blood that they are experiencing. So it's not enough for you to just be told that you are bleeding because of a subchorionic hemorrhage. This must be followed up with ultrasounds at regular intervals. Cervical changes. During pregnancy, the cervix becomes softer, it becomes more engorged with blood, and therefore it is more sensitive. And as a result, it is more prone to bleeding. With bleeding that happens because of cervical changes, the bleeding can happen at any time, of course, but it's more likely to happen after intercourse or pelvic exams when the cervix has to be touched, or later on in the pregnancy. Another unfortunate cause of bleeding cervixes during pregnancy could be cervical cancer. But we are in an era where cervical smears, also known as pap smears, are more common, and women should be observing their routine cervical smears, and the HPV virus 16 and 18 in particular, which are associated with cervical cancers, should be picked up early so that women are not falling pregnant and then finding out that they have cervical cancer. So not to frighten you, but just so that you are aware that in a very, very small percentage of pregnant women, their cervix is actually bleeding because they have cervical cancer in pregnancy. That is why if you are a woman who's actively trying to get pregnant, you will be seeing your doctor, and part of that workup should include a cervical pap smear. So we're hoping that if we were to find a concerning HPV, particularly type 16 and 18, it would be identified quickly. You would be treated and encouraged to wait before you fall pregnant. Because of course, if you're pregnant and then you find out that you've got cervical cancer, it's very, very, very difficult to treat. And of course, it will take you down an emotional roller coaster. The bleeding that happens as a result of cervical changes is usually light and of the spotting type, unless of course it's because of advanced cervical cancer, in which case the bleeding will be much heavier as time goes by. Light bleeding from cervical changes is very common. And once you've gotten checked out by your doctor and you've obviously gotten screened and anything sinister has been ruled out, yeah, it can be considered normal. It just means that for you, your cervix is extremely sensitive during your pregnancies. Placenta previa. This condition happens when the placenta covers part or the entire cervical area. It's more common in the second or the third trimester. With placenta previa, the woman experiences bright red blood and there is usually no pain. This is not normal. In fact, you will need an urgent obstetric review as it is a serious obstetric condition. So of course, if you're bleeding in your second or third trimester, one of the very first things that your doctor will consider doing is an ultrasound. And placenta previa will be picked up on an ultrasound quite easily. So it can be said that if you have passed your first trimester and you are bleeding in your second or third trimester, apart from blood show, which I'll talk about shortly, you need to be seen like ASAP. Don't delay. And bleeding in the second and third trimester, again, apart from blood show, is not normal. Placental abruption. It happens when the placenta comes away partly or completely from the uterine wall. It's most common in the third trimester as the placenta gets bigger as the baby grows. With placental abruption, the woman will experience a sudden onset of vaginal bleeding that looks bright red, and it can be quite heavy. And she will experience this together with lower abdominal pain that is more than just the odd cramping that happens here and there during pregnancy. Placental abruption is an obstetric emergency. It's a medical emergency. You need to be taken to the hospital immediately and taken under the care of the obstetric team. Blood show. As the cervix begins to thin, dilate in preparation for labor, there will be a release of what is known as a mucus plug. And that mucus plug can very often look blood-stained, hence the term blood show. This obviously happens much closer to labor and happens in the third trimester. However, you can get a blood show happening much earlier on, for example, in the second trimester. And when that happens, we worry about preterm labor. In other words, we worry that you're going to have a premature baby. It literally looks like mucus, but that has a pinkish, reddish, blood-stained tinge. Yes, this is very normal and it is a sign of impending labor. However, it is not normal if it happens before the 3rd trimester, it means that it is very likely that you're going to give birth to a premature baby, as I've previously mentioned. Infections such as vaginal thrush, sexually transmitted diseases can cause irritation and inflammation, which will lead to bleeding. This can happen at any stage of the pregnancy. You don't want it to happen at any stage of your pregnancy altogether, but it's more detrimental to the fetus early on in the pregnancy because it can affect the endometrial lining, preventing implantation and actually cause infection within the yolk sac. So you don't want it at any stage, but particularly in early pregnancy. Later on in the pregnancy, so the 2nd and the 3rd trimester, if you have these infections, they are likely to cause preterm labor or premature rupture of membrane. If you're fortunate, you will give birth to your baby prematurely. However, if you are not, these infections can lead to a stillbirth. The bleeding is usually spotting and light mixed with odd discharge, often foul smelling. You can have other symptoms like vulval itching and vaginal pain, swelling and redness in the vulval and vaginal area as well. Note, this type of bleeding is not normal. The type of spotting that you're getting with a very foul odor, plus or minus abnormal vaginal discharge, it is not acceptable. In fact, it can harm your baby. But thankfully, this is very easily treatable. So if you notice that, get to your doctor as soon as possible to prevent possible complications. That's it, guys. That's all that I have for you for this video. I hope it's been helpful and it's given you some guidance as to what might be the cause of your vaginal bleeding. Remember to subscribe. It is free. And liking our videos shows us that you actually enjoy what we're doing, encouraging us to produce more of this type of content. Share it to your friends and family. And as always, we will see you in our next video. Until then, watch all of the many videos that we have right here on ADOC. Look after yourself and we will see you later.